If you're a medical professional, then you need to understand the basics of epidemiology. In this video, we'll explore what epidemiology is, why it's important, and key terms that every healthcare worker should know. Video title: Epidemiology 101, the basics every medical professional needs to know. Video description: in this video, we'll provide a comprehensive overview of epidemiology. You'll learn about the history and methods of epidemiological research, the different types of epidemiological studies, and the interpretation of epidemiological data. We'll also explore the role of epidemiology in public health and how medical professionals can use epidemiology to make informed decisions about patient care. Keywords: 1. Epidemiology. 2. Medical professionals. 3. Public health. 4. Data interpretation. 5. Research methods. Introduction. Hello, and welcome to Epidemiology 101. In this video, we're going to explore the basics of epidemiology and why it's so important for medical professionals to understand. Epidemiology is the study of patterns, causes, and effects of health and disease conditions in populations. By understanding these patterns, we can identify the causes of diseases, develop interventions to prevent and control them, and improve the health of populations. So, let's jump in and learn more about this fascinating subject. Body. What is epidemiology? Epidemiology is the branch of medicine that studies the distribution and determinants of health and disease in human populations. In simpler terms, it's the study of how diseases spread and affect different groups of people. Epidemiology uses a variety of research methods to gather data, analyze it, and draw conclusions about health and disease patterns. Why is epidemiology important? Epidemiology is critical for public health because it helps us understand how diseases are spreading and affecting different populations. Healthcare workers need to be aware of the prevalence and incidence of different diseases and risk factors in order to make informed decisions about patient care. Epidemiology is also essential for identifying outbreaks of disease and developing strategies to prevent and control them. Key terms in epidemiology. 1. Incidence. The number of new cases of a disease in a specific population over a specific time period. 2. Prevalence. The proportion of cases of a disease in a specific population at a specific point in time. 3. Risk factor. Any factor that increases the likelihood of developing a disease. 4. Mortality. The number of deaths caused by a disease in a specific population over a specific time period. 5. Case control study. A study that compares a group of people with a disease, cases, to a group of people without the disease, controls, to identify risk factors for the disease. 6. Cohort study. A study that follows a group of people over time to identify risk factors for a disease. Application of epidemiology in medical practice. Medical professionals can use epidemiology to make informed decisions about patient care. For example, if a physician knows that a patient has a particular risk factor for a disease based on epidemiological data, they may recommend screening or preventative measures. Epidemiology can also be used to identify outbreaks of infectious diseases and develop strategies for control and prevention. Outro. That's all for this video on Epidemiology 101. We hope you have a better understanding of this important field and how it applies to medical practice. Remember, epidemiology is critical for identifying and controlling disease outbreaks and improving the health of populations. If you have any questions or comments, please leave them below. Thanks for watching.